I've had a lot of doctors actually say that to me, in my initial visit with them to talk about doing the transition on their practice. And I've had them point blank, well, why shouldn't I do this myself? And every one of those has already told me one of the reasons, one of the main reasons why they are interested in selling is time. They're like, man, I'm swamped between home and work and everything. So my comeback to them, first comeback to is, well, you can do it. I'm not going to sit here and tell you cannot do it, but there's a lot you don't know. Some of it you're going to learn by error, and that's going to take time. But it's like, that's what I do. It's what I do for a living. It takes a lot of time. Where are you going to get the time? You're going to take it from home, or are you going to take it from work? You're going to take it from both. So, and then as you make mistakes, which I promise you will, and you've got a buyer, and then mistakes are made and the deal falls through, you have to start over. So that's something you should really consider. Another thing is, some doctors, I guess they're almost embarrassed to admit maybe they don't know how to do something or feel like they should know how to do something, when really it's smarter, in my opinion, to just admit that you don't. And they do that in their clinical. They do. They're not going to try to do something clinically that they're not real comfortable with and have a mess as a result. So why would you apply that to the transition of your practice? Another big point that I like to make to them in that conversation too is, listen, there are several major decisions that you've made in your life, and the ones concerning your career was to be a dentist, to own a dental practice, and now you've reached the point to sell your dental practice. And it needs to be done correctly. And again, this is what we do between me and Matt and Ryan and John. In the last 7 years, we've sold over 150 dental practices. So we're pretty good at it. And you know what? We've learned a lot, because every deal, we have a saying, every deal's the same, but every deal's different. What makes them different is the personalities and then the emotions that come from those personalities, and our ability and experience in that to help moderate and control that and take the emotions out of the deal and stick to the facts and the protocol, or the processes we like to call it, and stick with it. And you've just got such a better chance of getting the end result that everybody wants, both the seller and the buyer. The challenging part of the trust factor is your time limitation of spending it with the seller, because you're going to start out with the seller, and then the buyer's going to come later, and you've got to gain trust through them. But what I've discovered is, through the process of getting the valuation done on the practice and your communication of all that and being honest up front and laying out what you see as the professional involved in our role, what those challenges are, and being clear in that way. Once you get the valuation done and they're happy with the valuation and everything, then you don't start bumping into these things that, if you would have just told them about it before, then it wouldn't have been a surprise. Then when it happens, they look at you and go, well, he told me that this could be a challenge. So doing those things is where you're able to gain trust in that short period of time and develop a relationship with them. And that's paramount. And one of my favorite parts of the job is the initial visit with a doctor that's thinking about selling, because I am brutally honest about things. And I also tell the ones that are better how proud they should be of what they've accomplished in their career, and how I respect that, and then the responsibility that I take on to help them transition that practice, and how I do not take that lightly, because they're only going to do this one time and it needs to be done correctly. And then the same thing with the buyers. I've gotten to where just here recently, I tell a lot of buyers, depending on the circumstances, how much doubt they may have, or they're really digging in too deep, or trying to get too many different opinions outside of mine and everything. And I'm like, listen, I'm really not here to try to sell you this dental practice. What I feel my role is to provide you with as much information as I can that would allow you to make a comfortable decision, but not just be comfortable, but you should be excited to move forward. Are you always going to have that little nagging doubt over here? Yeah, you probably are, but that comfort and excitement should far outweigh that where you want to move forward. If you cannot get there, my advice is to don't move forward. And I think it kind of catches some of them off guard, because I think they view our role is he's just trying to get this done so he can get paid. Another thing that validates trust with buyers and sellers too, for that matter, is our valuation. We take a lot of pride in the accuracy of them. So through our network of dental specific lenders, when you've got a buyer and then we share our file over and provide the valuation, and the banks run it through their system, they're like, man, they're spot on. I'd actually loan a little more money on this practice probably. And then they tell the buyer that, and then the seller knows that. That even brings more trust into the whole circle. And so that helps. And then you get CPAs that validate numbers. And once you start digging deeper for more people's opinion and everything, then you start getting varied little things different that causes problems. And sometimes it's people who are providing bad advice. Doesn't happen very often, but it does happen. It's gotten to where now, in my initial meeting with somebody who's thinking about transition their practice, I ask them about not only their patient credits, but their AR, because those two things are a line item together in most cases. And it's surprising how many of them don't know. They're really not. I mean, they know their AR more likely than they do their patient credits. But I've seen some that were really bad. And so then they have to go through this process to clean it up. And they don't want to do that. I can't do it for them. And it's just another challenge that's now into the deal. But I tell them up front, hey, what are your patient credits like? And if they can't answer that question, I demand that they, provide that information for me. And if it is out of whack, then, you need to start cleaning this up. This is the process. I'm not an attorney, so you have to make sure you're doing this the legal way. There is a process for that. You need to get somebody on your staff to handle this immediately. And a lot of times it's just stuff that's super old that that patient's moved far, far away or has passed on or whatever the case may be. And then the same thing with the AR. It's important to make sure that your AR is good. And when I say good, it's collectible and it's within that 30 to 60 day range, because that's going to impact the sale of the practice. How are we going to structure the AR? Are we going to sell it at closing on top of the sale price of the practice? Or are we going to have it collected for the next 90 days post-close? I prefer to sell it at closing. It just makes everything clean and simple. But collecting it post-close, is very doable, but they need guidance and help on that. And when you see the AR real high, there a lot of times there's legitimate reasons for it, but that's a red flag for a buyer. So as soon as you list them, you make sure you've had that discussion with them. So in the process of you finding the buyer and going through the process, by the time you get there, they've cleaned it all up and gotten it to where it should be. So it's a non-issue.